from WDTN, the station that's working for you. This is 2 News at 6.
It's killing us without having a program to go to and a safe place to get yourself back together and establish yourself. It's at a loss.
Now at 6, curbing the opioid epidemic is a top priority for Montgomery County as they work with the federal government to try and find a solution. But first at 6, how much is the county spending as they try desperately to control that problem?
2 News reporter Maytal Levy digging deeper into what's becoming a costly crisis. I'm here on the east side of Dayton, and everyone you're about to hear from in this story tells me this area is the most heavily impacted by the opioid epidemic. Montgomery County Sheriff Phil Plummer says even though that's true, there's no place in the county that's left untouched. It's a crisis we're all paying for with yours and my tax dollars.
I have done heroin. I've overdosed twice on heroin and was brought back with Narcan.
The road to recovery isn't easy. 31-year-old Sarah Northrup Fowler knows that all too well.
About age 13, I probably started to experiment with drugs. I come from a broken family, broken home, ended up kind of in and out of detention centers.
Sarah is refusing to become a statistic. The sheriff's office is expecting 800 overdose deaths by the end of the year. That's more than double from last year.
Currently, there's 512 deaths.
Montgomery County Sheriff Phil Plummer tells me it's a cheap high with an expensive impact.
We need a coordinated effort instead of just blindly spending millions of dollars.
I requested the county budget and found this year we're projected to spend nearly $24.7 million on the opioid crisis alone. Alcohol, Drug, and Mental Health Services Board Executive Director Helen Jones-Kelly oversees some of those finances.
What would you say to someone who says the county Adamus is not spending enough money on the opiate problem?
I'd say they're probably right.
Here's a breakdown of where that $24.7 million is going. Most of it goes to Medicaid and Adamus treatment claims at more than $20 million. The least of the spending going to Narcan at a little over $336,000.
Here at the Adamus Board, nearly a third of my budget is going just for recovery, treatment services, and prevention services for the heroin epidemic.
She and the sheriff may not agree on how the crisis is being handled.
There's no strategy.
But both agree there's not enough funding.
The county would never be able, and wouldn't I think be willing to tax people to the point where we would have enough dollars. I don't think we could afford it. There just isn't that ability.
There isn't enough resources for us to do what we need to do.
That's why both are hopeful voters will pass Issue 3 this November, a renewal levy that won't raise taxes and is expected to pour nearly $56 million annually for health, human, and social services into the county. If it fails,
that means that half of the dollars that go into this community for human services would be lost.
Sheriff Plummer pushing for more spending on law enforcement efforts.
Still need to limit the supply coming in, and we need to educate our next generation not to get into this mess.
So far this year, the sheriff's office has recorded more than 3,000 overdoses.
We average 15 overdoses a day.
One problem, he says, that doesn't add up. Right now, the county funds 90 inpatient treatment beds and 30 outpatient.
We don't think there's enough drug treatment. I don't think there's really a standard of care.
Do you think that's enough treatment beds in the community?
It's not just us. This is a national question. How many residential beds are the right number of residential beds?
For some, though, it's not enough. She tells me for people with a dual diagnosis of addiction and mental illness, there might not be immediate access.
There may be a wait time of 2 to 3 weeks if we have someone who has that need, but we'd still have them protected and connected to services while we waited for a bed to open up for them.
For Sarah, she believes for an addict, time is of the essence.
There's too many of us out here dying.
And the Adamus Executive Director Helen Jones-Kelly says it's important to note that inpatient treatment is not for everyone and addicts should be handled on a case-by-case basis. For a full breakdown of Issue 3, go to WDTN.com. Live in Dayton, Maytal Levy, 2 News, working for you.
As Maytal mentioned, you can find that further breakdown of the county's budget on this crisis on our website, and there you can also see where the county treatment facilities are located.